Good afternoon, everyone. Thank you for having me on this platform. My name is Roger Slengeri. I am a clinical application specialist in charge of patient monitor and life support at Mindray company. And we're working very closely in partnership with Crown Healthcare. And today, I'm privileged to introduce to you this state-of-art ventilator that is easy to configure, easy to use, and has many functions in the care of patients who are in the critical care setups who require respiratory support. Feel free to raise your questions on the chat box, and I'll be glad to respond to them at the end of my presentation. So let me share the screen with you. Mindray SV300 ventilator is a turbine-based ventilator, which means you only require oxygen for you to be in a position to run this ventilator. You don't need to have a medical air. So straight into the agenda, we're going to look into the challenges that we face every day in the management of our patients in the critical care setups. And the second agenda is that we're going to tackle those challenges one by one with the use of the SV300 and see how we can manage all that. So as an anesthesiologist or head of department or intensivist, what are the challenges you face every day in the management of these patients in your setup? You find you have a machine in your setup that doesn't have many ventilation modes or doesn't have so many functions that you require in management of your different types of patients. Two, you have so many junior staffs who are not well versed in the care of patients and in the use of ventilator. And as a nurse, what are the challenges they face every day? You find they have difficulty in operating these machines. Again, in terms of portability, they're not able to move around with these ventilators in case they're asked to go and do probably an investigations in the radiological department or any other department that probably the anesthesiologist will require them to go and do this. So secondly, the biomedical engineers, you find they face a lot of challenges, a lot of pressure in terms of technical support. You find the provider doesn't, they're unable to reach out for the customer in terms of technical support. So this is a much worrying trend among the biomedical engineers. So you'll find they'll always ask you, do you have a very good technical support? Number two, having a machine that is hard to maintain, and in terms of reliability and performance, it's a concern. So what is the question? The question is, how will Mindray SV300 ventilator help you tackle all these daily clinical challenges that you face every day in your setup? So Mindray SV300 ventilator, it is a comprehensive, very simple to use machine, and it is very adaptive to fit different clinical environments wherever you find yourself in, and you'll need to use this ventilator. As I've alluded, that you can use this machine in different clinical care setups. And as shown here, you see you can use this ventilator in the ICU. You can use it in the post-anesthesia care unit in provision of probably oxygen post-extubation. You can use, again, this machine in the respiratory ward in provision of oxygen therapy to the patient, especially high flow oxygen therapy. And now we'll talk about the oxygen therapy in the coming slides. And again, you can also use this machine in the ENT. So it is an all-round machine. So 3-in-1, you can use it for oxygen therapy, you can use it for non-invasive ventilation, you can use it for invasive ventilation. Looking into the total mechanical ventilation solution that you're able to provide in relevance to your department is that we offer extensive and advanced ventilation modes to include normal or the basic controlled modes, spontaneous modes, and advanced ventilation modes to include APRV, adaptive ventilation modes, which is an automatic closed loop ventilation mode, and other ventilator assistive tools to improve the patient synchrony. We're able also to provide extensive monitoring of parameters to include 4 waveforms, spirometry of 2 loops, 72 hours trend of data, and we are able to record up to 5,000 events. And in terms of the winning indicators, we are able to provide occlusion pressure, negative inflation force, the RSPI, and in terms of the special function also we have the Palmosite, IntelliCycle Pro, and the PV tools, and I'll talk about this as we proceed. In terms of performance of the ventilator, as I alluded earlier, we are able to do invasive ventilation with advanced ventilation modes. We're able to do NIV ventilation modes with excellent leak compensation features. And then also able to ventilate neonatal patients. And we are able to also ventilate this patient from 2 mLs, neonatal patients from 2 mLs. With the IntelliCycle Pro, in terms of patients and ventilator asynchrony, we are able to achieve this synchrony by having this feature in our ventilators, and you're able to ventilate our patients very well and improve their ventilation status. And having high flow oxygen therapy, of which I'll talk about it in shortly, is that having this function will help your patient in terms of improving the oxygenation status, as per so many studies which have been done recently. And of course, with the advent of COVID, we find the recommended therapy for this patient is only oxygen. You only intubate these patients when now there's no any other alternative. But the required therapy for this patient is oxygen, as we all know. So these are patients that is able to manage adult patient, pediatric patients, and neonatal patients from 2 mLs. High flow oxygen therapy function available in our SV300. And according to the study done by the New England Journal of Medicine in the year 2015, it showed that treatment of patients with high flow oxygen improved their survival rate. What is the clinical significance of having high flow oxygen therapy and in management of patients who require oxygen support? It corrects hypoxemia, and it will increase the end expiratory lung volumes through the CPAP effect, decrease the dead space, and lastly, improve the patient's comfort in view of humidification, active humidification. So this is how the oxygen therapy window looks like. There are only 2 parameters that you need to set: the flow and the fraction of inspired oxygen. We're able to provide up to 80 liters per minute in terms of flow. And in terms of fraction of inspired oxygen, we're able to provide from 21% up to 100%. And on the special functions, we have the IntelliCycle Pro, as I had alluded earlier, that you find patients normally fight with the ventilator. And in most occasions, you'll find the anesthesiologist, the intensivist, having a machine that is not able to synchronize well with the patients. They don't have any other option. The only option they have is to sedate these patients and even paralyze them for them to have efficient ventilation. With our SV300 having this IntelliCycle Pro feature in it, it's able to intelligently recognize the patient's effort and synchronize with the patient's breathing patterns, and thereby improving this synchrony. With this, you are guaranteed of enhanced good ventilation status of your patient. Second special function feature is the Palmosite. So this is, as you can all see that these are the lungs. And as you're ventilating your patient, you're able to see the resistance on both lungs. You're able to see the compliance of the lungs in terms of change of pressure and change of volume during ventilation. And also, in case the patient has got an effort of breathing, you're able to see the spontaneous breath on your patient through this display on the SV300. So these are very good features that will help you to know that my patient is doing well, and this will really improve the efficiency on how you work in these critical care setups. In terms of mobility, these are ventilators that are able to detach from the main trolley by a press of a button. And this is a trolley. So you see it has been detached from the main unit. So you use this ventilator to do intra-hospital transportation while ventilating your patients efficiently. It has a light weight of 9.8 kilograms, which is negligible in terms of carrying this ventilator. And with an inbuilt battery of 4 hours runtime, you're able to manage this patient very well without having concerns or doubt that probably my ventilator will fail. So 4 hours runtime is enough for you to manage your patients very well. Again, you're able to attach the ESI cylinders in case there's failure. You're able to attach this and you're able to run your ventilator very well. And then in terms of ease of use of this ventilator, remember this is one of the challenges that most of the end users fail. And you find as a service provider, you're always called to be asked, where is this function? We are not able to get this function. And then when you take them through the training, probably via the video watch, they wonder, okay, the function was just here. We were just struggling and we could not get it. But with our SV300, all the functions, you have a quick access to all parameters in a very logical manner. As you can see, you're able to see that like this part is the ventilation mode setup window. This part is the ventilator parameters, like the FiO2 you want to set. It's all available there. And then the ventilator assist application tools, you're able to get them here. And in terms of the user interface, you're able to get it here. So it's not a very big deal. You're able to get all this from the user interface. And then in terms of the essential information, you're able to get all the essential information according to your needs. For example, for a junior staffs who don't understand how the machine works very well, once you power on the machine, it prompts you into a system check, and it gives you graphical guides on how to do the system check. Like, for example, connect the hose to the oxygen pipe, connect the breathing circuit to the ventilator, and then continue with the system check. So it directs you on how to do the system check. So it is a very easy ventilator to use with no hassles. And then with continued ease of use, again, in case you need to set the alarm limits, we have a visual guided test, as I've shown you before. And again, the alarm range indicator, you're able to set the alarm limits very well with the indicator. In case it is very, like the patient's parameters are very high, it's able to indicate to you that, okay, this is the fire much you can reach, and you're able to set it very well by color coding here. And you're able to adjust this based on the patient's current condition. In terms of reliability and performance of the ventilator, I had said earlier in my presentation that it is a turbine-based ventilator that has an outstanding performance. We are able to provide a flow of up to 200 liters per minute, pressure of up to 80 centimeters of water. What does this mean? It means that it fulfills most of the acute patient's needs that probably you'd want to have, especially when you're giving probably high flow oxygen therapy. With this flow that is able to be provided by the turbine, it clearly tells you that, okay, you're able to manage your patients effectively and very efficient. And then with the turbine, you're able to run for 20,000 hours, which is a very long time, run time and maintenance free. And in terms of IPC, infection control measures, and with the advent of COVID-19, the regulations are, we want to have a detachable inspiration valve. This design is according to the latest guideline offered by the CE guideline, which offers better infection control. And the SV300 is among the few ventilators that can support this latest guideline. And we are able to disassemble both the inspiratory and the expiratory valves. And we are able to support up to very high temperatures, around 134 degrees Celsius in autoclave. And with this capability of the SV300, we can further reduce the cross-contamination risk that may happen in the critical care setups. And then with the flow sensors, we use the latest hardware design where you find it is very easy for you to calibrate. And the flow sensors also support the autoclave sterilization. And with extreme temperatures or even environment, you find they're not affected by moisture nebulization when you're doing this to your patient. So these are very strong and very robust flow sensors that can give you value of your money. And in terms of maintenance, they are very reliable. We are able to provide capnography for both mainstream and side stream, depending on your preference. And also we are able to provide integrated SpO2 measurements of our patients, just a plug and play sensor, as you've seen. And the beauty is that all these parameters or these consumables and of capnography and SpO2 are compatible with Mindray patient monitors. Thank you so much for your time. And if there's any question, please feel free to ask, and I'll be very glad to respond to them. Thank you so much for your time.